Good afternoon. Today I'm joined by the Secretary of Health, Kim Malzum-Risden. I had some phone calls this morning with the United States Secretary of Agriculture, Sonny Perdue. We talked over the Smithfield situation, and the USDA is working with CDC to finalize the report, and we expect to release it to you all tomorrow. We also are working on personal protective equipment and securing that for this facility, and we've put that request in with FEMA, and also testing supplies so that we can get those resources in place so the facility can open up as soon as possible and start processing. I had a call this morning with our county commissioners as well. That went very well. We had a lot of participation and questions about what they're seeing in their local counties, a lot of encouragement, and also questions being answered on how to implement different things as far as social distancing and enforcing those guidelines in their local areas. I do want to remind everybody of a few facts of what we're dealing with in South Dakota. When in regards to testing across our state, I want to remind everybody that per capita, we are the 18th highest in the nation. We are the second highest testing rate in our region. And it's high because we have found a cluster, obviously, in Minnehaha County, and we're aggressively putting our resources there. We also, as far as hospitalization rates, have 61 currently statewide. And as far as South Dakota deaths per million, we're one of the lowest in the nation. That's all good news, and we're going to continue to be proactive in order to make sure we're protecting as many lives and people as possible throughout the spread of COVID-19 in our state. I know a lot of folks are anxious to get back to normal. The warm weather is coming and here. Folks are getting antsy. They want to get back to normal. We do have a phased approach to how we're going to have to do that in our state, and it will continue to be driven by data. We will continue to use the information that we have, the science we know about this virus, to make decisions. And I am going to continue to ask the people of South Dakota to be innovative in how you implement the strategies that we have laid out. I need businesses to work with their employees to make sure that folks are comfortable, that they feel protected, and that they're ready to get back to work. And we all need to make sure that we're making smart decisions for ourselves and for our families. And in result, that will impact our communities and how they weather the situation that we're in. A couple of days ago, I set up a medical review committee. This committee is going through the president's plan that came out of the White House called Opening Up America Again. They're looking at those guidelines and giving some input into how that would be approached here in the state of South Dakota medically. But they're looking at it through a medical viewpoint. We will then take whatever those recommendations are and add a perspective to it and lay out the groundwork for how it will be implemented in our state in the coming days. We know that how those medical recommendations come forward, we'll have an opportunity to be put into action as soon as we're able to review them and get that finalized. Again, I want to remind you to be steady and to stay the course. We need to continue to practice social distancing. I need to have groups under the size of 10 throughout the state. Our peak infection and hospitalization date remains the middle of June, which means the course you've been on for the last several weeks needs to be maintained for several weeks yet. We're doing a great job, and I'm incredibly thankful for your heart and effort into what's been going on in our state. I need you to be consistent and to continue to go forward. Call your doctor if you're experiencing symptoms. Stay home as much as possible and continue to be encouraged about the fact that we're doing this together and that we've got support from all sides to make sure we're doing it successfully. We have 15,000 people that have downloaded the Care19 app. I want to continue to encourage people to download that app. We had some folks on the county commissioner call say they're having difficulty in the app store. There is a link on covid.sd.gov to download that app if you're having difficulty right on your phone. Go ahead and access that on your browser. Go to covid.sd.gov, and the link is right there on the website for you. With that, let's go to any questions that you may have.
Or the secretary, if I could start.
Sure.
Thank you. Can you confirm, since your noon press conference, case of COVID at a retirement living center in Pierre, and what steps are being taken?
I am not able to confirm a case of COVID-19 in a retirement center in Pierre. The way the process works is we get all positive lab results. The cutoff is 5 p.m. We make contact with any of those positive cases over the next 24 to 36 hours. And so if there are those kinds of details, we would not necessarily have them yet.
Bob?
In terms of the bill that's coming through Congress right now,
Okay.
From your perspective as a governor, what does it mean for South Dakota in terms of aid to state government?
Well, there will be resources in there for hospitals. I understand there will be resources in there for small businesses that they can access some funds to help get them through this difficult situation. What I've been talking to our congressional delegation about and other leaders in Congress was the need for some accountability built in that allows states to use some of these monies for revenue loss. And I don't believe that language is in this bill. And one of the explanations I've given to them is that states are literally on the front line responding to this virus right now. And as soon as the president was on national TV asking the state and asking people to stay home, they did that. He asked us to stay home for 15 days, and without any mandates or forced business closures or shelter-in-place orders in South Dakota, the people of South Dakota did the responsible thing and they stayed home. That dramatically impacted our economy. And that those states that are run responsibly, that utilize low taxes, low regulatory structures are going to be hit the hardest by not being able to access these revenues to account for losses that are coming in because of the economy being hit. So I'm hopeful that they'll give us some language that'll allow us to do that, because I still have to run a Department of Corrections. I still have to run a Department of Social Services. I need to keep my Department of Health going. All my agencies are on deck working every day to serve South Dakota, and funding that in the future is going to be difficult if we don't have some language to where some of those revenue sources would be available to us. I would, Bob, add to that our congressional delegation's been very helpful. They understand, and they've been advocates for us.
Governor, this is from Dakota News Now in Sioux Falls. Part of President Trump's guidelines for states to reopen is that they have adequate testing capacity. How much testing would be required for South Dakota to fulfill that guideline?
You know, they're leaving some language in there that allows us to determine what that would be. And Kim can give some more specifics if necessary. What I would say is, yesterday I was on a phone call with the Vice President where they laid out all the resources that our labs have, and then we put in requests as well for supplies to adequately run those labs to their capacity. And that's what we're working on securing. So I know that the Secretary of Ag's been helping, the Vice President, Dr. Birx has been on the phone with me several times the last day or two. We're already in phase 1 in South Dakota. And that's one thing that I think is good to remind everyone, that we're in a better position than a lot of states as far as getting back to normal, because we have current actions in place to already be engaged in phase 1. But we'll have to continue to mitigate and take actions in order to protect people here for several more weeks. So we're looking at that, and I know there is some flexibility built in, and I don't know if Kim has something to add.
It's just testing. I think the key is making sure that people that have symptoms of COVID can get access to tests, and the supplies are the biggest aspect of that. And as the governor said, we're working very, very hard to continue to procure those supplies.
We're in a much better spot with testing supplies than we were 2 to 3 weeks ago, for sure. But do we have enough? Not yet. I still would like to be more aggressive in our testing capabilities, because it allows me to identify folks quicker and get them isolated and slow down the spread even more. Is there a question on the phone lines?
Yes, Governor.
This is Stephen Gross from AP.
Let's go with, I think it was Stephen from AP.
Thanks, Governor. I wanted to ask you about the hydroxychloroquine trial. I had a question about that. If the 1.2 million doses that the state procured from the national stockpile, is that being used for the trial as well as for COVID-19 patients whose doctors administered that to them?
Stephen, this is Kim Malsom-Reisden. So the state supply of the hydroxychloroquine will be available to any positive patient in the state whose provider wants and advises use of that. So they'll be able to access that state stockpile for that purpose, and then it will also be used for the clinical trial that is also happening. It will not interfere with other people who have other issues that require the use of that drug. So the supply chain that we're using is totally separate, and we don't expect any disruptions to other folks that need that drug.
Was there another question on the phone?
Jackie with SDPD.
Sure, Jackie, go ahead.
Continuing questions about testing. I know we've talked in the past about testing people who are asymptomatic. I'm wondering if we have an update or a review of that policy, especially as it relates to healthcare workers and other people who are known connections to hotspots.
Jackie, this is Kim Malsom-Risden. We are not recommending that asymptomatic people get tested, and so that is not a change there. We are working to get enough supplies so that we can ensure all symptomatic people have access to testing. Healthcare workers are treated specially, and so they are a high-risk group. The state public health lab can facilitate testing and process testing for that group. And as far as, when we check in with our providers every single day, we know healthcare workers are being taken care of with the testing needs that they have.
Thank you.
We'll have a question in the room. Now we'll take a question in the room and then go to one back to the phone.
Governor, Bob Mercer, Keller Land. When you talked to the county commissioners today, what was top of their list in terms of what they'd like to see? And then secondly, or related, do you plan to take another run at the legislation that failed?
They did ask about that. One of Bob's questions is if they asked about the legislation that failed on veto day that was working to give some more tools to county commissioners to utilize throughout the situation we're in. They did ask about that, if we would need to call a special session in order for legislators to come back and reconsider that bill. I haven't had any legislators contact me saying they would change their vote. And so if those legislative leaders want to reach out and let us know, but there's no plans right now to call a special session on that. But there was a couple of counties that were asking about that opportunity. And then other concerns were some of their local parks. They wanted some guidance on game fish and parks, comfort stations, fish cleaning stations, what our plan was for the summer. Some of them were wondering how to address out-of-state travelers. A lot of the same questions we'd been getting from local leaders. And we also indicated to them that on the covid.sd.gov website, we do have a toolkit for local leaders that should be helpful to them on some of that. And a lot of the questions had to do with information that is readily available on that website as well. We'll continue to weekly hold calls with mayors and county commissioners because they're extremely helpful to us in carrying the message forward on maintaining the plan and the structure that we have in place throughout the state. And then it's good for me to hear what's happening on the ground in their communities too and see what needs to be addressed and where we can get more resources. Let's go back to the phone. Was there a question on the phone line?
Governor, this is Kelda Ferris with the American News in Aberdeen. Up in Brown County, we went from 20 to 27 cases after a couple of days without any. Can you attribute those new positive cases to any kind of source, or what information do you have on those?
So this is Kim Malsom-Risden. We're currently investigating the new cases up in Brown County. And so we had a question earlier if they were associated with any one particular employer. At this time, we can't say yes or no to that. We have been working very actively with the Dakota beef plant, as we talked about last week. So we had a team that was comprised of Department of Health staff, the Animal Industry Board, and our state veterinarian go and visit with the folks up there, review some of their practices. We were able to share some information that they could share with their workers in the languages that they needed. And so we've done some follow-up with them from there, and we'll also be making contact this week to help support their operation.
What kind of contact?
So the contact has been both in person and then over the phone, and we've sent them materials and guidance that they can be using in their plant.
Gotcha. Thank you.
You're welcome.
Yes, in the question in the room, and then we'll go back to the phone.
So us normal people will never be able to be as patient as you guys. Do you have a fence, like we like fence posts, signs, not an exact date, but in your talking to Vice President Pence and everybody, do you, and with all, you know, you look at all the different manufacturers and people that make supplies, everybody's saying they're ramping stuff up. And I believe, you know, we believe, but is there like a date? I mean, do you know around when? Is it like for realsies now? Like, are they like, okay, so we gave you that date now it's really gonna be.
I mean, as far as having adequate supplies?
Yes, ma'am. Like to go, like to, you know, really punch phase 1 right in the mouth and
Yeah.
just get that done.
You know, I would say the question is on when do we really feel we will have adequate supplies on the ground in South Dakota? Is there a date in mind? And I would say I don't have a specific date. I'm continuing to advocate to everybody that I talk to about the need to have our supply orders filled. We place orders with the IRR. We place orders with FEMA. We also talk directly with the Admiral. We talk directly with Dr. Birx, Dr. Fauci, the Vice President, the Secretary of Ag. And continuously advocate to have all the supplies that we need. And the supplies will vary from testing kits, but then we may one day run short of swabs, and we may run short of reagents in different areas, and we're constantly moving those supplies across the state to make sure that all labs are operating. But we are following the protocols that we have. We've been more aggressive in testing because we've had more supplies, but I'm going to continue to ask for more, because as the virus spreads throughout the state, we will have more demand. And I'm anticipating that and want to make sure that we adequately go out there and isolate those individuals as soon as possible.
Governor JP from KORN News Radio.
Sure. Go ahead, JP.
We're getting closer to the weekend and the scheduled races down in the southeastern portion of the state. If they do go on, I'm going to throw out something kind of crazy, but is there any way legally to track those who attend those races to see if they could possibly be spreading the coronavirus?
Not that I'm aware of, JP. I think that this is an opportunity for people to make a wise decision to stay home. I think that I've been pretty strong in telling them that I do not want people to go to those races, but I don't have another mechanism to really track if when they leave there, if they could potentially be exposing the virus to other people. And the main reason behind that is because we know that 80% of the people who are positive for COVID-19 will have minimal, if no, symptoms whatsoever. So the only way you would know if somebody with certainty was positive was if they actually were tested, and we're not currently actively testing people in the state that don't have any symptoms.
Thank you.
Other questions on the phone? How about in the room? Good? Okay.